A report titled Impact of the Economic Crisis on Women and Children in South Asia, released by Unicef, says that the turbulence in commodity and financial markets followed by the economic crisis has added about 100 million to the list of people suffering from chronic hunger in South Asia in the space of 2 years. This is the highest level of increase in hunger recorded in 40 years. Mint spoke to Daniel Toole, the regional director of UNICEF, and here are a few excerpts from the interview. What is the impact of the economic crisis on women and children in South Asia?
What we see, and perhaps the most dramatic impact, is that we see that there are about 100 million more people hungry in South Asia than 2 years ago. That's a huge change. It's the biggest number of hungry, almost 400 million people hungry in South Asia, bigger than 30 years ago, bigger than 20 years ago, the biggest since the big famines in the 1960s. So that's a really, really big impact already.
What worries you the most?
For UNICEF, our fear is that as rates come down, so as India starts to see 5% growth, not 10% growth, what will happen to those same people? When the economy, when the government decisions in India, Pakistan, Bangladesh didn't protect the poor when they were growing at 10%, what's going to happen at 5%? That's where we need new policies, we need new concentration on women, on children, on growth, and on malnutrition.
How hard do you think is the economic downturn likely to hit the poor?
We know that the economic downturn will hit them more. If you're in a poor family here in India or in Pakistan, you spend about 60 to 80% of your income on food. If food prices go up, you've got no margins, and so you've actually got a situation where a family has to take a decision. Do they pull a child out of school, or do they pull food off the table?
How successful do you think is India's National Rural Employment Guarantee Scheme?
I think it's been very successful. It has constraints, all programs do, but I think that the fact that you have a program here in India that guarantees a certain minimum number of days means that people know they have income and it's stable income. Is it perfect? Probably not. But it's being copied for Bangladesh, it's being looked at in Nepal because it works. I think it should be expanded in India. It probably needs to be targeted in some ways, but it's a system that works and can be expanded.
What are your suggestions for the countries who invest more in military advancements than in public health and education?
My suggestion, UNICEF's suggestion, is spend less on military, more on education, more on health. Governments make choices. In South Asia, we have a series of conflicts that are very difficult, and so some countries have invested huge amounts of money in military. We believe that they need to invest more in health. India needs to invest more in health. India needs to invest more in education. If you compare the Indian investment in education with the Singapore, the Chinese, the Malaysian investment in education, it's far lower. The results will be far lower also for India's future.
The report holds that this is particularly alarming at a time when more than 50% of South Asian population is moving towards the working age. For Mint in New Delhi, Nadeep Hardwaj.